The Doug Stephan Good Day program continuing now with a focus on a different kind of medicine. One of the four regular featured doctors that we have on the program is Dr. Bruce Shannahoff, who is a West Coast chiropractic who specializes in spinal decompression. His website is 818newback.com. I don't think there's a person alive, and it's because of the way we were engineered. We're supposed to, according to some, Bruce, be on all fours, but because we are upright, it puts more pressure on our back, and our back hasn't developed into an organ that's strong enough to carry all of our weight. Is that about it?
That does seem to be the case, plus a lot of misuse on the part of the owners of the backs and the way they lift and the activities they do.
But just look at it this way. The bright side of this, Bruce, is if they didn't screw up their back, you'd be selling peanuts at the circus.
Mm-hmm. Well, that's true.
All right, so there you go. That's the bright side. All right, so what do you have for us between the lines this week?
Well, Doug, I was looking through some articles this week, and I saw that there's a new study that links depression to an inflammatory state in the body. In other words, inflammation in our body aggravates or creates depression as an emotional disease that people have.
All right, which comes first, depression and disease, or disease and depression?
Well, often these things are in a circle. It's like a downward spiral. The more depressed you get, you're probably producing chemicals with your brain that are causing more inflammation that furthers the depression. But this is also a common theme. You remember, inflammation is linked to heart disease. It's linked to cancer. It's linked to, so many diseases that people have.
Well, isn't all disease by definition an inflammation of something or other? That's really what disease. At least that's what I learned. Is that any disease is inflammatory?
Yes, that's true.
Yeah.
That's true. So, what it comes down to is, from the patient or person point of view as to what they can do to take better care of themselves is to work at fighting inflammation, which would include would include things like, we've talked about turmeric in the past, the Indian spice that's highly anti-inflammatory, and taking that on a regular basis. People can Google lists of inflammatory foods and anti-inflammatory foods and take an inventory and see, how much of their diet is on one side or the other, and try and work towards anti-inflammatory foods. De-stressing, getting exercise, meditation, even, just watching funny movies helps to de-stress and lower the pH of the body and therefore inflammation. And finally, chiropractic has also been shown to be effective in studies at lowering the pH and lowering, and creating greater alkalinity in the body and fighting inflammation too.
I'm glad you said that. We have a few seconds left here. The whole business about alkalinity versus acidity, I was studying this. Meredith and I were both looking into it over the weekend. It's an amazing thing what the body out of sync. The alkaline state of the body is preferable. However, most of us are acidic, and that's not a good bath for your cells to be functioning in. So again, lots of food for thought, something to think about. The fact that you might take a little apple cider vinegar to modify things like that would be good for you. Dr. Bruce Shannahoff, 818newback.com. Check out his website.